I think, first of all, the media portrays it as natural and normal because for many women, it can be that way. Not everybody struggles, but my experience as a lactation consultant, many do. And for those women, I really, really do need to stress, if they are watching and worried, that there's so much that can be done to help you along your journey of breastfeeding. First of all, make absolutely certain that you educate yourself and surround yourself with the right information. Secondly, I would highly recommend that you set up a consultation with a lactation specialist before your birth. That way you can go through anything that's worrying you, you can discuss the questions that you have and they will be answered honestly and intelligently, hopefully, by someone who is qualified in that. Definitely. Not their breasts. Interestingly, a lot of women think that they need to prepare their breasts for breastfeeding, and there is no research that supports that. Preparing your breasts and nipples is not necessary. What is necessary is to get the right knowledge and to speak to the right people and to surround yourself with those people who are able to give you positive messages around breastfeeding. There are so many organizations and specialists that are available, and I would really recommend that new moms set themselves up with an appointment with one of those people and first go and discuss this. Secondly, I would stop Googling, because moms who are Googling very often get the incorrect advice and they're not always sure what sites to go to. There are some very recognized sites that are highly professional and up to date, and those sites I would recommend that they. And find an antenatal class that covers breastfeeding. So a good antenatal class run by a qualified midwife, preferably, that includes breastfeeding in their course. And then I would visit the hospital beforehand where you're going to give birth and find out if they have a lactation specialist on their staff that will go a long way towards helping you with breastfeeding and getting off to a good start. The list is very, very long, and it absolutely does make a difference. Breastfeeding is so important, not just from a nutritional viewpoint, but also from the attachment between the mom and baby. We know that breastfed babies have less diabetes later in life, less chance of obesity, they have greater health, less allergies, less visits to the pediatrician with illness. And we also know that breastfed babies usually are much easier to calm. Just imagine food on demand whenever you need it, the perfect temperature, in the most perfect package, with no price, free, and fantastic for the baby to get that. And of course, in the very first few days when the baby gets the colostrum, they're getting immunoglobulins, antibodies, so many good things to help coat their esophagus and bowel so that they can have a healthy gut later in life. The reasons are endless. Yes, there are. There are some moms, even though it's only a few percent, that would be moms who have had previous surgery, may find it difficult. Some moms who have had their breasts reduced or have had their breast enlarged may have to do a combination of breastfeeding and bottle feeding. That's absolutely fine, because any breast milk that's given is a great advantage to the baby. There are moms who have certain health conditions that are not supposed to breastfeed. There are rare instances where the medication could interact and come across to the baby. In those cases, then it would be safer not to. Absolutely. First of all, if you're scared to breastfeed, it's okay to be scared. I don't want you to feel any less a mom if for some reason you can't breastfeed. But what I can say is, a lot of the time those fears are based on not facts. It's really just a feeling or a perception that it may be difficult. Perhaps take it day by day and see how you go. Surround yourself with help. Make sure you have a lactation specialist on board. If you are scared of sore nipples or of pain or not having enough milk, rather make sure that you take it one day at a time. And if that does happen, that you seek help immediately or as soon as possible. The colostrum is literally liquid gold. When we have a look at a baby's tummy, and this will probably help moms quite a bit to see, we know that in the first 1 to 3 days, their tummy's tiny, like a marble, and they only need 5 to 7 mils. So when the mom is concerned that the baby's not getting enough, we always say, let's get a teaspoon and hand express, and if you get a little bit, you can give that to the baby, and it's a whole feed. It's perfect. We're not too concerned about volumes. We would like the baby to be skin to skin as much as possible, feeding when they need to feed, and in the early days you may need to wake them. The baby who's sleeping a long time, we would be concerned about low blood sugar, hypoglycemia, or the baby who's not waking up. It could well be that it's because they haven't been fed, and that's got a lot of danger signs. So you need to wake your baby up in the first couple of weeks, 3 hourly in the day, with a 4-hour break at night, and that is to establish the breastfeeding. The first 2 to 3 days, moms are giving their babies colostrum, and you'll see here how the tummy slowly gets bigger, and this is sort of day 3 to 7, and from day 7 to 14 onwards, there's quite a difference. So we don't need to worry about volumes in the beginning. It's little and often, and that's perfect for the baby. Absolutely not. You can never, ever spoil a newborn. They are here to be loved and protected, and you can never, ever feed them too much. So if they need to feed, you feed them. And the general guideline would be 8 to 12 times in 24 hours. So if your baby hasn't read the book, your baby's not a robot. It doesn't know that the book says 4 hourly. Most babies, as mentioned earlier, digest the breast milk in an hour and a half. The baby who needs to feed every 2 hours, normal. Sometimes they might want to go on and cluster feed in the evening. So you might be thinking, gosh, do I have enough milk? You never need to doubt that. If the nappies are good, that's a great sign. So feeding in the evening between 6 and 9 p.m., many babies want to be off on the breast, and this is a very difficult time because you're quite tired at this point, but you do need to know that there's something in the breast milk actually helps the babies to sleep, and this is the time that they're helping to get your supply up. It often dips a bit in the evening after a long day. So feeding your baby, you can never spoil them.